Hi, my name is Gopal Reddy. I'm a final year medical student. Today we are going to perform eye examination. What is your name and age?
I'm at 22.
Okay. Uh, we are going to perform eye examination. Is it okay with you?
Okay.
Okay. Do you have any past history of eye surgeries?
No.
Do you have eyeglasses?
No.
Okay. Now we are moving on to the visual acuity test. Okay. Now place the patient 20 feet away and ask the patient to cover one of his eyes and read as much as possible.
AXOTVHUAXHTOVXAUMT.
Okay. With another eye.
AXOTVHUAXHTOVXAUMTVHIIXUV.
Now we are going to perform near vision test. Ask the patient to read a paragraph in a book with 14 inches away.
Iron is transported to in the bloodstream by transferrin. Transferrin saturation is reported as percentage. It represents the ratio of serum of iron total iron binding capacity multiplied by 100.
Okay. Now we are going for visual field test. For that finger wiggling test. When you see my fingers, tell me.
Yes. Yes. Yes.
Okay, close one of your eye.
Yes. Yes. Yes.
Close another eye.
Yes. Yes. Yes.
Okay. Now we are going to check the sclera and conjunctiva. Look up. Now look down. Look up. Look down. Okay, your conjunctiva is pink and sclera is white. Now we are going for conversion and diversion test. Okay, look at the wall and focus on the pen. Okay. Now I am going to check the pupillary reflex test. For that I am putting light directly to your eye. Okay, we are going for a rapid light test. Okay, now indirect pupillary test. Okay, I am going to check your eyelashes, eyebrows, and eyelids. Look for any scars or lesions. Look for any masses or swelling or edema. Now I am going to look for your eyeballs. Are they situated in the orbit or not? Okay, now we are going for the extraocular movements. Focus on the pen. Now we are moving on to the ophthalmoscopic examination. First place the diopter at 0. Check if the light is on. And use your right eye to check the patient's right eye. Can you close one of your eye? Okay, next. Other eye. Okay, I can see your retina, optic disc, fovea, and macula. Okay, after the completion of the examination, thank the patient. Thank you. First, inspect the hair of the patient. Next, inspect the scalp and skull of the patient. Inspect the skin and face. Check the sinuses. Thank you. Okay, now we are going to perform nose examination. Inspect the nose of the patient, nasal flares. Look for any nasal deviation, nasal septal deviation. Perform ear examination. First check the outer ear pinna. Look for any scars or lesions or any asymmetry. And with the help of otoscope, check the tympanic membrane. Look if it is bulged. Now we are going to perform a whisper test. Repeat the word which I am saying. 66, 66, 99, 99. Okay, now we are going to perform Weber's test. Tell which ear you can hear more.
Both 7 and equal.
Okay. it stops.
Stop.
Can we hear it now?
Yeah. Stop. Yeah.
Okay. Examination. Ask the patient to open the mouth. Check for vulva, the hard palate and the soft palate. And now with the help of the tongue blade, depress the tongue and look for the vulva. Look for any masses or swelling. Now we are going to perform neck examination. First inspect the neck of the patient. And now check the lymph nodes of the patient. Pre-auricular, post-auricular, submandibular, sublingual, submental, anterior cervical, posterior cervical, supraclavicular and infraclavicular lymph nodes. And now we are going for thyroid examination. Ask the patient to take sip of water. Okay, swallow. Check the thyroid and cricoid cartilages. And now we are going to auscultate the neck of the patient. Thank you. We are going to perform chest examination in our patient. First, we will introduce ourselves to the patient and ask for the patient details like name, age, and after that, we will ask the patient consent to perform the examination and we will explain the procedure to the patient. Now, ask the patient to undress and expose only the part that we are going to examine. First, general inspection. We will ask the patient to sit upright with her hands flexed and we will look for any scars, lesions, or asymmetry, or nipple changes, or skin changes. And next, now we will ask the patient to keep her hands on her hips and ask her to lean forward and check for any masses, scars, swelling, nipple changes, skin changes, or asymmetry. And again, we will ask the patient to keep her hands behind her head and look for any masses, scars, swelling, or asymmetry, or nipple changes, or skin changes. We will ask the patient to be in supine position and cover the part that we are going to examine. And first, gently squeeze the nipple and look for any discharge. If there is any discharge, look for color, order, and consistency of the discharge. And same with the other nipple. While performing, we should start with the asymptomatic breast first. And if there is any discharge, we look for color, consistency, and order of the discharge. For examination of the breast mass, we use spiral method. And we will use three finger pads for palpation of the breast tissue. And while palpating, if you feel any mass, we can note down. And at the same time, we will perform palpation on the other breast also. We have to palpate from superficial to the deep. Examination of the axilla. We will start with medial, lateral, anterior, posterior, and the apex of the axilla. After this, we are going to perform the general lymph node examination. We look for cervical, supraclavicular, infraclavicular, and parasternal lymph nodes. After completing the procedure, we will ask the patient to dress up in private and we will explain the findings to the patient and we will thank the patient. Now we are going to perform abdominal examination. First, we are going to inspect the abdomen and look for any scars, lesions, or swellings or any abnormalities of the abdomen. And next, we are going for auscultation. Okay, now we are going for percussion, percuss all the four quadrants. Okay, now we are going for palpation. Palpate the liver and now palpate the spleen, palpate the kidneys, thank you. Okay, now we are going to perform digital rectal examination. For this, ask the patient consent before performing and ask the patient to lie on left hand side and inspect for any scars or lesions. Now lubricate your hand and gently place your index finger into the anal canal and rotate it 360 degrees clockwise and anti-clockwise direction. And note the mucus of the anus and the color. Thank you. Now I am going for hand washing. With the help of the sterile towel, now I am going to perform doing of PP. First sanitize your hands. Now first we are going to wear non-sterile gloves and sanitize your hands. Now going to wear a face mask. Sanitize your hands. And now I am going to wear head cap and sanitize your hands again. Now I am going to wear the PPE.
Okay.
Button now.
Now I am going to wear the scrub. Now I am going for jogging. Now we are going for the fin of PPE. And throw it in the dustbin. Okay, then sanitize your hands and remove your head cap. And remove your face mask. And sanitize your hands. And now remove your PPE. And sanitize your hands. And again sanitize your hands. And remove the gloves. And again sanitize your hands. Now we are going to perform one hand knot tying. Now we are going to perform two hand knot tying.